and which organisation that you work for or you're representing today. And please could you mute if you're not participating in asking a question or one of the speakers. For those of you who don't know me, I'm Paul Cattrall. I'm one of the 2 network development workers on the NACCOM team. And for those who perhaps are on the call who are not familiar with NACCOM, we are the No Accommodation Network. We are a charity which is a national network of organisations providing accommodation and support, primarily but not exclusively, to destitute people seeking asylum. Our membership includes 117 organisations, charities and projects, 70 of which are full members delivering accommodation of one form or another to people with NRPF and others. We currently have 32 housing property schemes, 25 hosting schemes and 14 night shelters within the membership, which is spread right across the UK from Glasgow to Southampton, Northern Ireland, South Wales. Our membership is very diverse. It includes small housing projects, hosting schemes, right up to a couple of members that are traditional housing associations. What unifies the members of NACCOM, the NACCOM network, however, is a commitment to bringing an end to destitution amongst people seeking asylum, refugees and migrants with no recourse public funding living in the UK. We have given today's webinar the working title of Providing Accommodation to Refugees and People Seeking Asylum in the Changing Landscape of COVID-19. Although it has been suggested by both our speakers that a better title might be Why We Will Never Open a Traditional Night Shelter Again. More on that later. I'm pleased to introduce our 2 speakers. They are Annika Joy, who's a project director at the Glasgow Night Shelter for destitute asylum seekers, and Matt Lambert, who is CEO of Enterprise Homes based in Wolverhampton. Annika's project works exclusively with people seeking asylum who are left destitute and homeless, whilst Matt's organisation is a general homeless charity working with a broader range of people with NRPF conditions and others. Both projects have seen a radical change in response to COVID-19. And what we're going to hear about today is how COVID-19 has provided an opportunity to rethink service design, respond to a more engaged range of statutory authorities, and deliver a more holistic and client-focused accommodation model to achieve positive move on for the people that they support. We will hear from Annika first, and then Matt, who will each speak for about 20 minutes, and then we'll have plenty of opportunity for Q&A. If you have questions, if you'd like to put those in the chat, Katie, my colleague Katie, and I will be monitoring the chat, and we'll look to try and bring in as many of those questions as possible when Matt and Annika have spoken. So we'll now over to Annika.
Hi, I'm Annika. That was a nice little introduction there, Paul, around why we won't ever be a night shelter again. I remain the director of an organisation that is named something that I don't want to do, and I'm hoping to be the director of an organisation that doesn't have a job to do eventually. So that's kind of a bit of a context of where I'm coming from. It's really nice to see so many different people here today, and to get to know some of the members of the network that I haven't met before. I've had most of my contact with the network in Scotland. Glasgow Night Shelter for Destitute Asylum Seekers, to give it its full Sunday name, grew out of the humanitarian crisis towards the in 2011, when a group of volunteers identified that there was a particular prevalence of rough sleeping amongst people seeking asylum in the city. Glasgow is the biggest dispersal area in the UK and the only dispersal area in Scotland, or the only dispersal city in Scotland. And so it was a kind of uniquely Glaswegian situation that was growing and becoming concerning to people. And so a group of really committed volunteers just started doing what probably many of you have done as well, which is opening doors, opening church halls, opening churches, and making sure that people had somewhere at least warm and dry to stay overnight, perhaps be able to have something to eat, and perhaps make some connections that would allow them to seek support or further support in the city. And the organisation carried on doing that, in defiance of many a church hall that got fed up with having us around, many a local MP or MSP or councillor that got little notes of complaint from neighbours who were a bit knocked that there was quite a lot of people hanging around waiting to get into a building at 8 o'clock at night. These are probably stories that are quite familiar to all of you as well. The organisation carried on doing that 365 nights a year, mostly done by volunteers, and we've been doing that for nearly 10 years now. And a year ago, we received some kind of core funding from the National Lottery Community Fund, so what was the big lottery. And we were, with that funding, able to sort of start to set out what a long-term plan would look like. So how do we stop being a night shelter? How do we become something that is dignified, has something that is sustainable? And that contributes to preventing homelessness rather than stepping into a crisis as far as possible. And so that was the kind of the beginning of a move to become not a night shelter. And we were 6 months nearly into that process, that journey, when COVID-19 happened. So we were running an overnight shelter in an empty building. We had a couple of members of staff who were, employed to work overnight. There was me, who was employed to try and develop some kind of alternative option. And then there was 25 guys staying with us each night. And eventually hoping to move into home office accommodation. And then I'm trying to think when it happened, but I would say it's probably the beginning of February. One of the sessional members of the team, who is a visual artist and makes work for some quite famous artists, he had been in Texas working with an artist making something, I don't even know what he was making, and he came back to the team meeting and he was like, so what are we going to do about this coronavirus thing then? And we had been sort of starting to hear little bits of news, probably like many of you, around, maybe we all need to just be a little bit more careful about washing our hands and all that kind of stuff. And all of the planning that we'd been doing to move the organisation into a 24/7 service where everyone would have their own room, their own shower, their own toilet, kind of proper ensuite accommodation, which was planned to start from the kind of April-May time of this year. Suddenly we're like, goodness, if only we had that now, people could be a lot safer and a lot better. And by the beginning, probably by the middle of March, we realised there was absolutely no way to hasten that process. And as the Scottish Government started to issue guidance on social distancing, and the public buildings started to shut down, like many of you will have seen or personally experienced, the guys who stay with us use public buildings during the day in order that they can stay warm and safe, and use the toilets and use the libraries and all those kind of things. And we realised that not only was our own service not fit for purpose in a pandemic, I mean, it wasn't really fit for purpose anyways, but it was certainly not fit for purpose in a pandemic. There was nowhere else for the guys to be during the day. And we had a responsibility to act really very, very fast to turn something around. And this is there was a kind of slightly, yes, to be honest, like slightly crazy 24 hours when me and one of the team rang round every single hotel in Glasgow that we could get hold of a telephone number for, because it turns out they've all got these 0808 numbers and you don't actually get through to a human being. And we spoke to everyone that we could get hold of and said, this is our situation. We support people who have no recourse to public funds, so that at this point, it doesn't look like the local authority or the national government in Scotland is going to do anything. But we know that we can't do anything to help. So we'll somehow manage to cobble together some money to pay you for your rooms. Please, can the guys who stay with us come and stay in your hotel? And our experiences ranged from some people saying, absolutely not, to some people saying that'll be £185 per room per night, and we will remove all of the furnishings, and we will remove all of this, and we will remove all of that, and da, da, da. And by some incredible bit of luck, one of my team got hold of this woman who married to a social worker, and she was like, oh yeah, absolutely, yeah. I'll talk to head office. I reckon we can probably do you a pretty knockdown rate, because nobody wants to come on holiday to Glasgow at the moment. And I'll get back to you. And probably within about 45 minutes, she was back to us saying, you can rent our hotel floor by floor. You will staff it yourselves 24/7. We'll provide the basics. We'll make sure that there is housekeeping and laundry and all that kind of stuff, but it will become your accommodation. You can run your organisation from our hotel, and it was just, I had no desire to become a hotel landlady, but somehow in the COVID land, that's what happened, and within, I think it was probably 36 hours later, we were running a hotel with another charity. So we, on the fly, we told another charity that we got this special deal, and they were like, oh, that sounds pretty good. It's not like one of the usual B&B type places that the council uses. It's actually got proper facilities, it's clean, it's dignified. Yeah, we might like to comment on that. So we took over, so it's Salmon Community Scotland. They took over the penthouse suite. They took the top 2 floors. We took the second and third floor, and there was a no man's land in the middle. And we've been running a 24-hour service from that building since the 21st of March, and 131 destitute asylum seekers have stayed with us during that period, and we continued, possibly in defiance of some of the lockdown rules, to redevelop the building that we were hoping to move into, so that as soon as possible people weren't staying in a hotel, because albeit having your own room and your own shower and proper food and support and access to casework 24 hours a day and all that kind of stuff, you're still staying in a hotel, and that is not a very nice place for anyone to be. So we carried on trying to kind of open our new place, and yeah, we just sort of, I don't know, it was kind of like on the spin of a tail. We went from being an organisation that ran for about 14 hours a day, with a kind of skeleton sessional staff, to an organisation running a hotel 24 hours a day for up to 48 people at any one time, with joined up casework which was provided by the Scottish Refugee Council, mostly, which was brilliant, with rooms and facilities to make sure that people could make contact with pals and also with other lawyers and things like that, using Zoom and things like this. And the biggest pain in the neck was trying to make sure that people could eat well. Actually, many of the other things were relatively simple, and I was reflecting with Paul and Matt maybe last week, I think it was, that when people during lockdown have been saying, oh, nature is healing, I have been feeling the most incredible amount of guilt about the amount of single-use plastic that has had to be used in our service, because in order to make sure that people's food and was hygienic, it had to be hand delivered, individually wrapped to each hotel room, 3 meals a day, and then disposed of. And it's a sort of point of concern to me, really, like just how much stuff like that has been created as a kind of, just to take the shine off of what's actually been achieved. So we're still operating this service. We knew and had been saying locally in Glasgow for a few years, there's not enough accommodation for people who need it in Glasgow, and what there isn't really good enough. And we say that about ourselves, not about other people's services, but about our own service, acknowledging that a night shelter is not a good place, a good healthy place for people to be, that it's not particularly well coordinated, so it's kind of, people don't end up in the best place for them. And so with this kind of bandwagon sort of mantra of mine that I've been banging for a few years, we said, well, we're going to carry on trying to open our new place, but we're going to also try and hang on to some of the additional capacity that being able to operate from an empty hotel has given us, which would mean that fewer people would have to resort to rough sleeping or other types of survival decisions than have had to do that in Glasgow to date. And I actually, like, what time is it now? 2:20. I had a confirmation about 45 minutes ago from the local authority that they want me to carry on doing this at least until the end of the calendar year. So we now, one of the things that's come out of this is, it's all public health funding. It's not any kind of substantive funding. We're not quite at the point of change yet. But the first block, so from April until end of August, the funding for everything, staffing, the hotel bill, all came directly from the Scottish Government. And then when the Scottish Government ceased to fund at the end of August, the local authority was asked to step in by the Scottish Government, so that it was a kind of clear line of when it was national emergency, and then when it's the kind of local issue that needs to be dealt with. And that's the bit that's been asked to be carried on until at least the end of this year. So I have some reservations about the kind of like, woohoo, COVID solved so much. It hasn't really solved anything. What it has done is allow us in the short term to add capacity to a city that was really, really struggling to meet the needs of destitute asylum seekers, of which there are many. We estimate that at any one time there's probably about 200 people need accommodation in Glasgow, and our data over the last 6 months would sort of strengthen that as well. So I think what we've achieved during the time is a kind of a bit of prevention and a bit of a demonstrator that when the capacity is there, it's used, it can be used safely, people can be directed to access the services that they need and the things that enable them to perhaps re-engage with their asylum case. And as I said, perhaps in slight breach of lockdown, we have also managed to finish redeveloping the new place where we are now based, and we run the service that we had always intended to run from a 20 ensuite bedroom facility. It's a former housing, it's owned by a housing association who've leased it to me on a peppercorn, and it was used previously as homelessness resettlement accommodation. So it's sort of fairly purpose built for what we use, and it's in a really busy, exciting part of the city. It's not in a tucked away in some dark corner of the city. And we opened that on the, what day is today? We opened that in the middle of August. I'm trying to come up with a date. Sorry, the time flies. We've been open for 5 weeks now. And that means that the thing that we thought that we were trying to do was delayed by COVID. But one of the things that we've been able to do is actually increase capacity. And we thought we might be losing a little bit of capacity. So we've kind of achieved that. But we are still in the individual meals stage. And I'm kind of interested to know what other people are doing around stuff like that as well, because it still seems to be the guidance that we have to provide everything individually to keep everyone as safe as possible. I feel like I've talked for long enough, and you should probably hear from Matt, but I can take questions at the end, Paul, or and I will also flick back through my notes, which I completely ignored while I was talking, and check that there's no pertinent points that I forgot to tell you as well.
Thanks very much, Annika. Thank you. And as Annika said, if you could put any questions you have in the chat, we'll monitor those, and then we'll bring those questions and any other questions that are generated from Matt's contribution at the end. So, Matt Lambert, over to you.
Yeah, hi everyone, my name is Matt Lambert from Enterprise Homes Group in Wolverhampton. I'm hoping that I will have some stuff to say that will be of interest. It seems like most of you work with destitute asylum seekers, which is very slightly different to what we do. We do a little bit of that, but we do a bit of everything in general homelessness. But I will try and kind of look at some of the lessons that we've learned that aren't just applicable at an operational level, kind of some of the principles and stuff like that. I really do want to start off by echoing what Annika said about, ultimately, if I do my job well, in 5 or 10 years' time, I won't have a job, and I don't want to have a job. We really see our role as transitioning the sector as a whole from homelessness services into housing services, which, outside of the considerations of destitute asylum seekers, we actually believe is fundamentally possible. We started out in a kind of similar way from very small beginnings. Our shelter started out in 2016 when a lady died on the streets of Wolverhampton, and myself and a couple of guys got together and basically said, we're not going to let this happen again. And so we did 70-hour weeks for 6 weeks and did a pilot project for 4 weeks in a church hall that we'd borrowed. And we thought actually we'd done something. And at the end of it, an Eastern European couple came to us the night the whole thing was having to close down, because it was just a pilot project. And they said, we feel like you've treated us like cattle because you're putting us back out to pasture again. And you can imagine that, at some level, we understood completely what they were saying, but at another level, we'd put our hearts and souls into doing this and thought we'd actually done something positive, and yet the reaction wasn't exactly what we were looking for. So we've been trying for 4 years now to see if we can make the service permanent and tweak it little by little to end up in a position where we'd have something that would be what you could describe as adequate. I'm not even sure we ever really got there, because in and of themselves, just having a night shelter gets somebody off the streets, but the lack of dignity and the way services are run, it just doesn't give people what they really need deep down at a human level. And so we were looking at all of this and thinking about some of these things at the beginning of this year, and then so it was end of March that things started to go a bit pear-shaped in terms of public health, and the local authority came to us on the Wednesday and said, right, you're closing on Friday, we're moving everybody into a hotel. And we thought, okay, not sure how that works. I had to think about it. I had to have a quick trustee meeting. Didn't really have any choice. And we raised all sorts of concerns, because we'd looked at whether something like this was feasible in the past. And 6 months prior to that, if you'd asked us to risk assess a facility with individual rooms with people who are still using Class A drugs and alcoholics and you know, multiple complex needs and all the rest of it, mental health issues, it just wouldn't have passed any form of risk assessment. We'd have been far too concerned that, you know, we'd end up with some kind of lawsuit against us for gross negligence manslaughter or something like that. But then when COVID hit, the thing that really changed in many respects was that we moved from, can we do this, to how do we make it work? And that's a very different question to be asking from a risk assessment point of view. And so the local authority asked us as an organisation to move all of our staff over, and eventually after a couple of weeks, asked us if we double the number of staff that we were providing, because they were finding that the level of service in the hotel was really good. So we ended up with 2 members of staff on the front reception of the hotel from 8 a.m. to 8 p.m. Monday to Friday. And they were really acting just as the liaisons with everybody else in some senses. We now call them our first in-reach workers, because the guys that we're working with, they have somebody that is there, their first port of call, the first person that they can reach out to, that they know that they've built relationship with. And I think that's something that is really important, and something that we've learned and that anybody can take away, is that it's great having a variety of different services that are brought around an individual, but it's never easy for an individual who's been through the kind of circumstances that the people that we work with have been through, for them to engage with what might be 4, 5, 6 different services to be able to get what it is they need at different levels. And so even if you bring all of that into one place, if you haven't got somebody that is simply standing by you and being that person that is the hub at the center of the spokes, that gives it all a sense of cohesion and meaning, can broker those relationships, can hold your hand, go to appointments with you, and just be a friend in some senses, almost taking the professionalism out of it, it makes a massive difference in terms of the levels of engagement with services. And I think in that sense, there's so much goodwill in the sector from churches, faith-based communities, voluntary sector groups. And I'm constantly asking myself the question, how do we kind of bring that goodwill and everything that's going on at that level into closer relationship and partnership with the more professional services? Because you don't need those guys to be more professional because they'd lose the relationship, but you don't want the professional guys to be befrienders. You need them to be professional. So we need both of these things to be working really closely in partnership together for the sake of the individual. And I guess as the hotel went on, we very quickly realized that our night shelter was done. So I think I convened a trustee meeting about 3 weeks into lockdown and said to the trustees, I don't think we should be doing this anymore. On the one hand, the actual operational side of night shelters just isn't going to work. COVID-19 has drawn a line through that. If you can allow people to self-isolate, have their own rooms, you can't control the spread, you're putting staff at risk, there's health and safety, there's so many considerations. But the reality is that wasn't the primary reason. What had actually happened was we'd moved all these people into the hotel, and none of the risks, and I really do mean none of the risks that we'd perceived transpired. And there was a documentary on the BBC about what does a COVID hotel look like, and the article started off by saying, you know, how do you keep alcohol out of there? How do you stop people from using drugs? How do you manage this, that, and the other? And we basically said from the outset, no, actually, we're going to meet people where they're at. So we put sharps bins in rooms, and we made sure that if people were alcoholics and needed a supply of low strength alcohol, even simply for them to be able to survive, that was provided. It wasn't a hostile run environment where you have to stick to a set of rules and we're going to be stringent about that. And it was, we're bringing you in as you are, meeting where you're at, but then trying to see if, as a partnership of organizations working together, we can find ways to move you on, to make a difference, to engage with you in a way that brings some outcomes. What we started finding is that people that had been long-term entrenched rough sleepers for many years started engaging in really positive ways. And we were incredibly surprised at the level of engagement. We had health services came in around alcohol and drug addictions. And there was one particular afternoon where they booked 9 appointments. 8 out of 9 people turned up for their appointments and engaged. And the one guy that didn't had been recalled to prison in the meantime. So there was like this 100% success rate of people engaging on that particular afternoon. And we started seeing that the outcomes in that context arising out of treating people differently, giving them some dignity and respect and working with them where they were at, as well as the level of partnership that was happening across the sector, had brought us outcomes that we'd previously only ever dreamt of. So the reality is that over the course of what was everybody in and everybody out, we moved 186 people through a hotel in Wolverhampton, and at the end of August our hotel closed down because the service was no longer needed, because everybody had been rehoused somewhere in longer term accommodation. And so, you know, I come back to that point. About 4 weeks in, I addressed a meeting of the Homelessness Task Force in Wolverhampton and basically said, look guys, you know, look at the outcomes that we're getting, look at the quality of service that we're managing to provide and the level of partnership working that is going on. We don't feel as though going back to doing things the way we used to do them in terms of the shelter is the right thing to do. We feel as though there's a moral obligation on the sector as a whole to actually find a different way to do things that provides people not only with much more dignity and personal space, but also is achieving the outcomes that both they and we want to achieve from the outset. And in some senses, my aim was to make sure that there wasn't a safety net that we were providing. That whilst the local authority and partnerships were thinking through, right, okay, so what are we going to do when winter comes round, that they weren't thinking, well, we can always fall back on the shelter as a safety net because there might be something in place, and if we don't manage to get something going, then, you know, it won't really matter. And, you know, going back to doing something that you know isn't good enough, it's just not right in my books. So we have got plans afoot at some point. We're not quite there yet. It's the local authority that are really driving all of this, to recreate a hotel context, probably in a facility that the local authority would either lease or own, with about 15 to 20 beds, and that would be run exactly the same as the hotel was during COVID. So that will probably end up looking something like what Annika is doing now. And I think there's a sense in which actually that ought to be right across the sector in terms of night shelter considerations, the way that we look to do things in future. And I have had some high-level conversations around this. You know, I'm not suggesting that this winter, that if it is possible to do something in terms of night shelters, that we shouldn't. Because in some respects, we haven't necessarily managed to get all of the learning that we need to be able to, you know, just stop doing night shelters completely and move on to something new. But if we are going to get to a place where the government says, actually, with these considerations in place, with this level of precautions and COVID-19 safety measures, you could reopen, that actually we ought to be doing so for one winter only as a last resort, because we haven't got the possibility of getting to a place of doing something else, but saying actually we'll do this one last time, and then next year, by the winter of 2021-22, that we'd actually have found models up and down the country that enable us to do things substantially differently. And I think there needs to be an awakening in the sector that now that we know that things can be done differently, we have to be exploring how we implement that in our local areas. And most of that comes through partnerships. I think one of the things that we've found throughout the course of lockdown is that if you can get yourself into the right rooms, if you get yourself into the same physical space as other people that are working in your sector, you give them the opportunity to see what you're doing, to see the heart behind it, and to open up possibilities of working together, moving forwards and doing things differently. There's a quote by a guy called Stephen Covey, who talks about how much has been achieved over the course of history through the independent will of determined souls. but true greatness is reserved for those who will achieve and master the art of we, those who are working together selflessly and tirelessly with others out of mutual respect and for mutual benefit. And that sense for us, as we've decided as an organisation throughout COVID, that we're going to completely stop thinking about any innovation, any new projects, anything we're doing as an organisational thing. We'll take each project that we have thought about and think might actually do something for people across our city, and we'll put it out to partnerships and see if anybody else wants to do it with us, even if that might be to the detriment of our own organisation. Because we find that if you come in with an attitude of serving and serving with others, that actually, generally speaking across the board, that impact on those relationships, it means that people are much more willing to explore solutions together, to stop themselves looking at things from an organisational point of view, and to start really focusing on what is it that would make a real difference right across our city. Because ultimately, we're all here for one single purpose, and that is to serve some of the poorest, most forgotten and discarded members of our communities, and to do so not in a way that is good enough, but in a way that actually treats them like the human beings that they are, and realizing that there's no distinction between us and them, and we have to remove any form of binary talk from all of our ways of working, even our policies and procedures. I know that over the past 6 months, we've really worked hard as an organisation to make sure that anything that we put in place for our guests, participants, service users, things like that, that it's equally applicable to our staff, our senior staff, our trustees, that we treat everybody exactly the same. And I think that in and of itself makes inroads into the work that we're doing, because so many of the people that we work alongside have now come to the conclusion that they are completely worthless. They don't believe in themselves because society has said so much negative stuff and spoken it over their lives. And if we do that as well, or if we don't, really kind of bring ourselves into their space to understand where they're coming from, then we're never truly going to have the kind of impact that we want. And in some respects, and I think this is one thing that I've been realizing recently, is that accommodation and personal circumstances, for me, is now a secondary issue. And I know that there's someone here that will understand what I'm talking about, because we put in a funding application that got refused because we're not a housing-led organisation. And we started thinking about that as a consideration, and started thinking about, well, okay, yeah, actually we do accept that. Are we a housing-led organisation? No, actually probably not. What's our primary consideration? And it isn't actually providing the accommodation itself. It's social inclusion that is at the heart of everything that we do, and accommodation is part of that. But actually, you can provide things like night shelters, or even you can provide, single space rooms and great service provision at a physical level. But if you're not dealing with the emotional issues, if you're not seeing homelessness and destitution as first and foremost being an issue of finding somewhere where you get acceptance and belonging, then for me, you've missed the point. For me, any form of homelessness and destitution as well are all about the fact that you have nowhere to go, but not just physically. It's in your heart, it's in your head. You've lost a sense of who you are. You've lost a sense of location. You've lost a sense of country. You've come to somewhere trying to see if you can find somewhere to fit in, because you've been more often than not driven out of where you were before. And then you get confronted with that same sense of hostility in the place that you're coming to. And so more and more, my view is that we'll try and deal with the accommodation as best we can, but actually our primary consideration is you as a person. Where are you finding that sense of fitting in? Where are you finding that sense of belonging? How can we bring you into community in a way that restores your dignity as a human being? And how can we do that in such a way that it helps us to grow and be more human ourselves? I think that's probably what I've got to say for the moment. I'm sure there might be some questions, and for Annika as well, which we move on to the Q&A, Paul, is that okay?
Yes, that's fine. I just wondered, Matt, whether you might just say something about, because while you said earlier, a lot of people on this call will be working with asylum seekers with NRPF, and your primary NRPF group are EU nationals.
Yes.
I wondered if you just, and there are others on this call that a lot of their work is with EU nationals. I just wondered whether you could say something about the kind of move on kind of package, in the sense of how you get the person that's got in NRPF from the hotel into actual practical accommodation. You know,
Yeah.
how you get it. I think it would just help people to see how the journey has worked within your organisation. Just a couple of minutes on that, and then we'll go on to Q&A. Is that okay?
Yeah. So we were finding with people with no recourse to public funds that, you know, employment, certainly pre-COVID, there was plenty going. So you could get people into jobs, which then allowed us to put them into accommodation through our housing charity. But unfortunately, asking people to go from that point of having no responsibility and fallen off the grid and not having any routine to their lives, to asking them to hold down a tenancy and maintain a job all in one go, was asking them to take on too much responsibility. As an organisation, we believe that the onus is on us to provide people with the capacity to be able to take on responsibility. So we looked at, is there something that we could do in between? And there's a national minimum wage legislation exemption under Section 55, which allows us not to pay people national minimum wage by setting up a scheme for them, whereby they're paid with benefits in kind. So we've set up a training program with accommodation, food cards, bus passes, mobile phones, and a stipend, which enables us to move people with no recourse to public funds into their own accommodation and provide for them. And then they engage with us by participating in a work and training program from 9 to 5, Monday to Friday. We're currently doing that through a house clearance business, which is enabling us to recycle money back into the program to pay for the cost of the accommodation. And it's enabling them, us to take them on a journey over a period of about 6 to 12 months of not so much getting official skills, although we are working on that side of things, but really just getting back into a routine and a habit of getting up in the morning, of engaging with other people, of growing in that sense of personal responsibility, learning about making mistakes and growing in them, and trying to get people work ready. Because as an organisation, we feel that where it is possible for people to be working, that actually that gives them a sense of dignity, that not everybody wants to be a charity case where we're giving them everything that they get. A lot of them actually say to us that makes them feel uncomfortable. And if there's any way that they could be giving something back and working with us to make that a possibility, they'd actually prefer that. So we've now got 9 bed spaces on our residential training program alongside our house clearance business. And it's growing. It's mainly focused on Eastern Europeans, although you can set something up in a very similar way for the indigenous population. They just have to come off universal credit, and you're still getting more benefits than if you were on universal credit, which is quite meager right now. And it's another way of enabling us to not just to provide people with accommodation and work, but there's also a sense of community around those houses where people are coming together, living together, working together, but constantly with a view to how are we going to look at long-term outcomes, how are we going to move you on to getting your own place, getting your own job, and doing so in a way that means you don't cycle back like a lot of people have done in the past.
Excellent. Thank you, Matt, and thank you, Annika. Thank you both. Really thought-provoking talks there. I am sure we have questions. Although I haven't seen many. Have I missed?
I've got a question from Tom Cheeseman. If you want to just, Tom, do you want to introduce yourself and ask a question?
Hi, yeah, hi. That's fascinating. Both speakers, and Matt, I wanted to. I think I maybe missed a vital bit of information in your program. You were talking about last thing there, the training program.
Yep.
How is that funded? And
so in this season,
on the back,
Covid-19, where trading had to stop entirely, we've had to be reliant on grant funding, and we've managed to get grant funding to keep us going to the end of March. From April of next year, the house clearance business, which is a separate CIC, will be generating sufficient income to fund the entirety of the training program that these guys are involved in.
Brilliant.
So it'll be entirely self-supporting through enterprise.
Others in the meeting probably know more than me. Would asylum seekers with no right to work be able to take part in anything resembling that?
No. Whether or not you could do something that was entirely done on a voluntary basis around that is something that could be explored, but asylum seekers can't work. And for the purposes of Section 55 of the National Minimum Wage legislation, they are classified as workers in terms of EU directives around things like housing benefit.
Thanks.
Thank you. We have a question from Anna. I think it's Anna from Glassdoor, is that right?
That's right, Paul.
Hi, would you like to say your question, Anna?
My question is whether immigration advice services are integrated into both of your services, Matt and Annika. I can see Annika said yes.
Can I tell you a little bit about it?
Yes, please.
So we have a dedicated destitution advisor from the Scottish Refugee Council that works alongside me and the team. We in order to try and get people back into whatever statutory support they're entitled to as fast as possible, so that you don't stay in this precarious state as fast as possible. One of the things that happened was actually one of the kind of the kicks for us to act really fast to get people out of the shelter was that all of the frontline services like Scottish Refugee Council, British Red Cross, and other kind of frontline casework organisations, they all shut really, really quickly. And so access to services during the day just wasn't possible for people because those services had gone online and the folk had nowhere to go online to be able to access them. And so we turned our service into a 24-hour service with daytime, so people could be there during the daytime so they could contact their caseworkers, their lawyers, and all of those kind of things. And so each day there was a kind of rolling pattern of appointments for people. There was a triage to make sure that everyone with us had a lawyer, and a decent lawyer, not just a lawyer that was sitting around on their files. As a result, so I talked about there being 130 odd people through the service. Most of the people who came through and moved on into temporary Section 4, so covered grounds Section 4, as a result of casework intervention, and then some kind of continuous work on their substantive asylum claim. So there's that kind of triangle of everything pivots on you actually having somewhere safe to stay, because that's the place from which you can access other services, but casework being one of the primary ones. We're very lucky that there was some capacity in a legal in a legal project in the city that had been set up to support people who were at risk of a lock change eviction by Serco. It had some legal capacity because those lock change evictions had been stayed, and so we were able to redirect that legal support, so first line lawyer support, to people who were destitute and ended up staying with us. So it's worked really well, and we will now continue working exactly like that. We don't have the caseworker in the building yet, because the Scottish Refugee Council is still working remotely, but they're on every day with someone, and the legal support is still there as well. The lawyer support is still there as well.
Thanks, Annika. Matt, do you have any?
Yeah, from our perspective, we want to do really well what we do and rely on others to do the same. So in terms of our destitution work, we have a couple of bed spaces for destitute asylum seekers. That's done in partnership with Hope Projects in Birmingham, who are able to provide the legal advice side of things where it's needed if they haven't already got their own caseworker. In terms of the work that we do with people with no recourse to public funds, you've got the Refugee Migrant Centre in Wolverhampton, which is an award-winning quality organisation, partnered really closely with them as well, and they provide all of the immigration advice and support to our guys with no recourse to public funds that is needed. So for me, if you haven't already got that, partnership is a great way to expand that to your service users.
I second that, absolutely. Thanks, Matt.
Thank you. John from Lassen. You have a question, I think?
Yeah, cool. It's just a brief one to Annika. I've heard some people expressing concern. Your throughput is mainly going into COVID section 4, right?
Yeah. Not all of it. Some of it to section 10 and different things, but a lot of the initial throughput is to COVID ground section 4. I can see, yeah. So
it's really just a question around, because I've heard we don't provide legal support to people or anything like that, but I've heard some people expressing an opinion that by doing that it increases likelihood of detention or deportation. I wondered if you had a view on that, whether or not that's something that it's kind of, well, that's it, because that's how it works, and we're not there to be, there indefinitely for people.
No, it's definitely not. That's definitely not what we would. It's not a, yeah, that's fine. From us, what our kind of rights-based approach is that where someone has a statutory right, we hold the government to account to make sure they deliver on that, by making sure that everyone has a caseworker and a lawyer that's actively engaged in their case, and hopefully in their substantive case as well. We think we've done as much as we're able to as an accommodation provider to put a bit of prevention in place for some of that detention or potential move on. I think the thing that we're genuinely most concerned about is when the COVID ground section 4 ends, what happens in terms of homelessness. So I think it is less likely, and I can only speak for Scotland, I think it is less likely that we will see direct removal into detention and deportation here immediately, but we are likely to see a cessation of accommodation, and at the moment we see accommodation not being provided with any other sorts of support, that when that ceases, there's a massive spike in need. And trying to keep articulating this to the local authorities and to national government, that actually one of the reasons we need to keep the residual capacity and rapidly increase the residual capacity is that when that happens, because it inevitably will, there's a big spike in local homelessness from those people who got temporary support, because it's that the group that were in survival situations that felt safe enough to come forward because there was additional capacity in somewhere that they felt safe. So many people don't feel safe, and correctly don't feel safe in night shelters. They came forward, and then if that goes, they're in a really tricky predicament. I can see another little question as kind of follow-on question for this has come from Rhiannon as well, which I think is been another concern of ours. There's been, so dispersal to Scotland stopped at the end of June when there was a tragic incident in some of the Home Office accommodation, one of the Home Office hotels, and so there's been quite a lot of proposal for dispersal out of Scotland from people either in section 4 or sometimes into 95 and 98 elsewhere, in predominantly people being dispersed to the northeast of England.
Yeah.
And that has been a real concern for us. We've had a lot of refusal to travel. And people, because people's networks are here, as Rhiannon said, your support networks are here, you've built relationships of trust, either with our organisation or with other organisations that we've been able to hook you up with, and that is a real concern. So I think the two things that we're most worried about are what happens when the Home Office's public health support ends, so the COVID ground section 4 ends, and what happens if they stop accommodating, as they have done, stop accommodating people in Glasgow. And that's what we work with the Refugee Council on, to try and make sure that we sort of manage those risks and maybe don't immediately apply for section 4 for some people.
Thank you. Paul, Yes, go on, Matt. Sorry.
There's another question up there about old style shelters.
Yeah, I was just going to.
Destitute asylum seekers. And I'm going to play devil's advocate a little bit on this one, whether it be for destitute asylum seekers or general homelessness. You may not have caught it. I think it might have been a local headline, although I think it did appear on the BBC in Birmingham. There was a headline a couple of weeks ago saying 56 asylum seekers test positive for COVID-19. And so you kind of have to think to yourself, weighing up all of the various different factors involved, that if you've got 20 people in an old style night shelter and one of them introduces COVID-19 into the mix, the chances are all 20 will get it. And somebody finds out and you end up with a headline in your local newspaper saying 20 asylum seekers have got COVID-19. And there'll be a whole bunch of people reading that will latch onto that to start saying, oh, well, asylum seekers are spreading COVID-19. And you end up in a position where, whilst trying to help somebody on one front, on another front, in terms of trying to advocate for people and getting public opinion on your side, you're actually taking a hit. So there are all these extra considerations to take into account in respect of what are the dangers at a reputational level, and in terms of simply people's dignity and how they're, imagine you're one of those asylum seekers that reads that headline. Those kind of things have to be put into the mix as well.
Can I just follow up a little bit on that? And I can see someone else wants to contribute as well. So in Glasgow, our night shelter, which was specifically for destitute asylum seekers, has led the march on the end of night shelters. And just at the end of August, the Scottish Government agreed that there will now be no more night shelters in Scotland. And we led that march. We were saying a year ago, we don't want to be a night shelter anymore. We don't want it to be the default option for Black and brown people in Scotland to be a night shelter, and there be this brilliant housing first model for people who aren't of colour. And we felt really strongly that if we continue to provide a night shelter, we were colluding with a racist system. And actually, we just decided that we don't want to be part of that. And as a result, not as a direct result of that, but as a kind of follow on from some of that influencing advocacy and demonstrating that there is a different way around it. It costs more, it's really difficult to fundraise for, it's exhausting trying to persuade people that when people have got racist views, that actually the right to dignified accommodation is universal. It's exhausting doing that, and it's expensive to do it as well. But that we couldn't, in all good conscience, as an organisation, collude with a system that said, well, the kind of cheaper and nasty version over here can be okay for one group of people, but not for another group of people. And we're very lucky that the Scottish Government and the local authorities in Scotland have taken that on board, and that there won't be night shelters in Scotland as of now. There won't be one opening this winter. It will be provided with personalised accommodation for everyone. So excellent. I feel really positive about it.
Could I speak to the question, if that's okay?
Yes, Paul. Yes, it was your question. Yes.
So this comes from, I'm speaking from Nottingham. I work with Host Nottingham, who have families hosting destitute asylum seekers, and I coordinate the Nottingham Homelessness Voluntary Sector Forum that has all the homelessness charities kind of involved. So I have sort of a bit of cross-sector kind of into working with the council and so on. The issue that's come up really, and some of you will know about this from Jane Henson, who usually represents Host at these regular meetings. Nottingham has been particularly poor with respect to destitute asylum seekers during the COVID crisis. So they've tended to treat them rather differently to other homeless people because they have NRPF, but also they don't have the prospect of work. So they're even the bottom end of NRPF as far as the council seem to be concerned. The worry we have in the groups who work with the destitute asylum seekers in Nottingham is come late November, December, in terms of our primary role, which is normally to look at our client and say, how can we best help that client? The question we're struggling with is if there is no housing option of any description for those people, but we could generate using church halls, which are now liberated, because by January in Nottingham, there's likely to be a 43-bed, one person per bedroom accommodation for classic rough sleeping population of Nottingham, which will include NRPF, but probably will be overfilled. And the destitute asylum seekers have tended not to access the same accommodation as the other rough sleepers in Nottingham. If we have the choice between looking into a shared space or leaving people on the streets in December, and we have people who went through last winter in very poor health, sleeping in parks, whether we should be looking at it. I totally understand what you were saying, Annika, about the kind of the racist aspect of this and how you're colluding with the system to some extent. But as far as the people who work directly with clients, whose interest should be in the interest of that client, and I do appreciate that the knock-on, as Matt mentions, you know, could be a more negative effect for other clients, but whether anybody is still looking within this whole group really at classical old style accommodation, essentially in the face of local authorities, or at least nationally, not in favour. So we discussed this briefly in the summer with our local councillor with responsibility in this area, and she was somewhat sympathetic to the view that the MHCLG and national government would not consider any money from local or national government going into anything other than one person per one bed per one room. They would potentially at a local level accept if charities were still going to run something to make sure people were taken off the streets. So I think we still have a potential dilemma, and it may be a Nottingham specific dilemma, and that is that the council already, as some of you are aware, have not maintained a position of being obliged to accommodate everybody who is homeless during this the crisis. And I have to say that's partly because they say if they find people on the street 3 nights in a row, destitute, asylum seeker or not, they say they'll put them in a hotel. But they tend not to find the destitute asylum seekers because they don't aggregate in the same locations when they're sleeping rough as the standard rough sleeping population. I just wonder whether people, what people's take on that was. And I understand what you guys, the speakers, have said, and I'm sympathetic to your points. We have meetings coming up, and we just need to try and feed into that to work out a local solution.
Thanks, Paul. So, anyone in particular who's running shelters elsewhere in the country? Any? Yes, Joe.
Hi, I'm Jo Watters from Father Hudson's Care. So I just want to share our experience of Table House in Birmingham. We worked with, at that specific project, we worked with migrants with no recourse to public funds. We previously were an 11-bed night shelter, dormitory style. The council weren't that positive about the fact it was a dormitory in the first place, a dormitory style. But during the COVID crisis, they funded the Table House staff to actually provide support at the Holiday Inn for 50 people, and we proved there that we could work with migrants with no recourse to public funds and move them on. Following that, they've been more positive about our project, and we have reopened. We're not calling ourselves a night shelter, we're called supported accommodation, and rather than the guests leaving each day, they are allowed to stay there 24/7. We do have a number of we have four staff, and a number part-time, but we are still mainly volunteer led, so it is mainly volunteers doing shifts. And the way we've managed to do it is a building company have come in and done pods. So we was at Midlands today, so those in the Midlands may have seen us a couple of weeks ago. So we have plastic glass screens in between each bed. We've reduced the beds down to 6, and then we've managed to acquire a 3-bedroom house with the school up the road, where we could actually do some segregation if we needed to. So we're just having that prepared, and we had some money from a trust to do that. So whilst we are still a night shelter, we've just sort of changed our terminology. The pods are working, and outside of the pod, which is glass, a glass perspex area, you have to wear PPE. We've got full risk assessment in place. We're keeping in regular touch with the council. We've opened with 3 beds so far over the last couple of weeks. Everyone has a COVID test that comes in, which is getting more difficult this week, especially in Birmingham. And we've got a couple of referrals we're going to take on, but we won't go above 6. So I just wanted to share our kind of experiences really. So we are still running, just in a different way.
That's really useful, because Dennis Tully, who runs the Winter, he runs Emmanuel House, and under whom umbrella the winter shelter ran, and he's been the guy who's negotiating with MHCLG and the City Council to get this 43-bed ex-Salvation Army property for the standard shelter. But he proposed using pods in a shared space, and this was essentially rejected by the local council, but it was rejected to be funded by MHCLG and council. So if you've got a model that's been accepted and is running in Birmingham, it's a kind of, I appreciate this is last resort as far as we're concerned, you know, one bed in a house, in a room is what we're looking for. But come this winter, it would be really useful to have the precedent of your system, and also potentially to come and have a look at it. So that we, because the aim is for the organisations in Nottingham who work with destitute asylum seekers to work alongside the guys who've always run the winter shelter to generate a destitute asylum seeker specific shelter that they can access and will access. So so that sounds like a model we could potentially copycat, and that'd be fantastic. So I'll get in touch. Thanks. Unless anybody else has any other alternatives.
And I think in some ways that really highlights what I was saying about we may need to find some way of doing something for this winter, but the old style model of moving around church halls in ways that has been done previously, that just isn't feasible anymore. You can't, even church halls themselves aren't going to work, because you're going to have to adapt so much to be able to make it COVID safe that you're not going to be able to use the space for anything else really, and you're going to need something that you can hang on to and provide for that entire period over the winter. So there may be a hybrid solution that could be done for this winter whilst we're trying to find other solutions, but the level of intricacy involved in terms of the policies and procedures and the physical setup of the space is going to have to be incredibly well thought through and with safety and precautions in mind throughout.
Thanks, Matt. We have about 6 or 7 minutes left of our allocated time. So if there are any more questions, don't be shy. What I was just going to say on modular units, there are other examples around the country of pods within buildings. I know that I was at a housing justice event last year, and they were on display, a sort of modular marine ply unit. There's also a very innovative project down in Dagenham and Redbridge, which is called Malachi, which is worth checking out. Now, it's a much more longer term solution, but this is a modular movable unit that's basically like a bed set in something like a shipping container, but isn't a shipping container. That's basically can be put onto a site and it can then be moved when the site is needed. That's a project that we had speak at our last annual conference, and we understand that project is likely to be, has potential with funding to be replicated elsewhere in the country. So if you're not familiar with Malachi, I would really recommend you check it out. It was birthed by the Salvation Army in Dagenham and Redbridge, but we understand that others are looking at that very closely. Is that a question from Hannah Locke?
Hiya, yeah. I was wondering if Annika would be able to talk a little bit more just about that, when you were sort of saying that it had got moved from being a national crisis and then to sort of like more of a local responsibility, just how that transition was managed. I think that's what we're struggling with. Most of the organisations or sort of areas that I'm speaking to is that where we're moving people out of hotels now and trying to sort of transfer that responsibility to local authority that are sort of really unsure about or uncomfortable about spending their funds on people with no recourse.
Yeah, so Paul advised me before I started, but one of the rules is that I wasn't to swear during this. You kind of asked the question,
Okay.
most likely to turn me into profanity.
Thanks, John.
So, just let John mute himself.
I'm well, thank you. How are you?
John's having a phone call, and
Katie, can you mute John? Oh, he's done.
there's probably a little bit of kind of like partisan politics here that you'll maybe pick up a little bit from me, but I think you just kind of take it as it is. The Scottish Government have been pretty brilliant during this period, certainly in terms of direct provision, direct funding to me, just to make something happen. That speaks to the officials more necessarily than it does the politicians, but who've also been good. But there are the officials in the homelessness team who were previously like, what's a destitute asylum seeker, have suddenly have really, really got it. And that's been brilliant. And I have really kind of used them as the lever with the local authority. So the local authority have never really wanted to touch this situation because they are, you know, they're a dispersal city. Their relationship with the Home Office is quite fragile. They see the Home Office changing the nature of dispersal to the city, which puts a huge pressure on local resources. And there isn't a plan for the end of it, which is how our organisation comes to exist, because when someone's refused, there's nothing in the city, or the city claims that there's nothing it can do, and the city's basically just been bumped into this situation now where it kind of has to do something. And I've simply used the national government to force the local authority to work with me on this, because they were fighting amongst themselves in the background, like, oh, you should be doing this, you should be doing this. Meanwhile, you know, it's 7 days before the end of the point when I'm meant to be talking to people who are already living with insecurity and trauma around, well, actually, sorry, I don't really know where you're going to go, because some dude in an office hasn't made his mind up who's paying for this yet. And so I've really just used the national government as the lever to push the local authority. The local authority have sought legal advice for sure around the limits of where they have to go to. I'm of the view that a local authority doesn't seek legal advice to find out how much they can do, but rather to where their kind of bare minimum and limit sits, and that would seem to be where they've got to. We have a homelessness. I'm not overstating it. There's a homelessness crisis in Glasgow. You know, that the situation is not in good shape. The local authority was already being not investigated. There was already an inquiry into homelessness service from in the city, anyways, and so the council are under a massive amount of pressure. But I think they've been forced by the hand that feeds them to act and to take responsibility. I just don't know how long it's going to continue. I think that's, you know, as I said, they phoned me a couple of hours ago to ask me to continue until the end of November. I don't really see how that's going to solve the situation, but it's slightly longer than they've ever indicated before.
That's really helpful. Yeah, that's really useful to know. Thank you.
Thank you. We've run out of time for questions, but I'm just going to ask my colleague Katie just to give a 1 minute promotion of our next webinar, which is next week.
Brilliant, thanks, Paul. Yeah, really kind of similar tones to kind of some of the things that you've been talking about here, especially Matt with yourself. Next week's webinar on Tuesday at 2 o'clock is all about evolving experts by experience within your service design. Whatever kind of that looks like. It's been a fantastic project that's been working over the last few weeks with experts by experience to deliver it. So if you're interested, please sign up. We've got lots of interest, and it's going to be continuation of work after the webinar, so it's not just a one-off. So hopefully you could join us.
Thanks, Katie. A very big thank you to Annika in Glasgow and Matt in Wolverhampton. That's been really excellent, engaging, lots to think about. I've certainly been provoked by your contributions. I'm sure a lot of other people have. If you have any questions, other questions, please email them to Katie and I. You can use our development@naccom.org.uk. We will be making the recording available, and just get in touch if there's anything you'd like to discuss further. So we'll just say goodbye and keep doing all the wonderful work that you're doing. Thank you. Thank you, everyone.